We're excited to offer you a high-definition, three-dimensional CT scan of your sinuses today. This will answer so many questions. And here's a CT scan. This is a CT scan of my lovely wife, Dr. Lee Scarata. So we see down here that this is a three-dimensional image of your skull. And they say that true beauty is on the inside. And you really have to admit, she's got a pretty good-looking skull, doesn't she? So this information here can be rotated any direction you want. You can see here are where the eyes are. They call the orbits. This is where the nose is. This is the upper dentition here. We call the maxilla. There's a cheekbone, the infraorbital rim. Go rotate the head to the side. We see the zygomatic arch, the parietal portion of your skull, your mandible, your ramus, your condyle. You can even look on the inside. And I assure you that my wife has a very large brain, but you can't see it here because we only translated the bony data from these three windows into this three-dimensional image here to look at the skeletal structure. So if you want to see her brain, you can see it on the other images. But pretty much here, the upper 1/3 is where the brain sits in the anterior skull base. The middle 1/3 is where all the sinuses are. We think that's the good stuff. And you can look at this in different dimensions. You can look from below up, and you can look from any given side. We can change the signal intensity to make the bone show up a little more clearly. But for the sake of this mini video, we will move on to interpreting her CT scan. So we'll turn her head sideways here, and this is the sideways view. It's three different dimensions. We got the sideways view with her brow, her nose, her lip, and this is her nose. This is the front view here, and this is laying down the back, looking straight up the ceiling view here. So if we take this orange line here and scoot it out to the tip of her nose, the tip of her nose, her upper lip, her upper lip, her brow, her brow. So as we move in here, we get reoriented from the side view to the front view. Around the outside of the head is black, and black is air. White, well, white is bone. Gray, gray is soft tissue, unless the gray is on the inside of a sinus. So let's continue back. You can see we're moving back. Here we see the cheek sinuses here called the maxillary sinuses. Nice and black, we like it. Here's between the eyes are the ethmoid sinuses. Up here were the frontal sinuses over your brow. So nice and clear, so far so good. Getting back deeper and deeper, straight septum, inferior turbinates here, and this one here has got a little bit of swelling that could cause her some nasal congestion or obstruction. As we move back further, these middle turbinates rotate around upon themselves, and so this is somewhat wide here, perhaps creating some more nasal airway obstruction. If that's a complaint of this patient, that could be why she's feeling that way. We move back further, we get back to the sphenoid sinuses, and this is where you see infection. So the back behind her left eye, and you can often get headaches from this, there's 5.69 millimeters of infection. And if you put these crosshairs on top of that infection, you can then look in all three dimensions and see where the infection is. So here's the infection here, gray tissue. Here's the infection down here, gray tissue. I hope that gives you a little overview of what you're going to see with your provider here shortly. Each of our Modern Nose Clinic sites has one of these next generation CT scanners, and that's what you're going to get. It's the lowest amount of radiation of all the CT scanners, and it does 300 pictures in less than 15 seconds. With this information, we're going to really be able to give you a treatment plan to plot your course for success. So, in just a few moments, one of your providers will be walking the room with you, and we'll get to review your CT scan. And as we are developing the process to do this, we hope to be able to send those people who are interested a copy of their CT scan to their email. And you can review them with your spouse, your family members tonight, and show them how the Modern Nose Clinic taught you how to read your CT scan. Oh yeah, I can't forget this. Remember, we know your nose.